In this video, we're talking about three specific conditions: situs inversus totalis. We're also talking about dextrocardia, and we're also talking about a condition called heterotaxy. Guys, I'm Dr. Jen. It is good to see you. Let's talk about our normal anatomy so I can explain what these conditions are. And by the way, these conditions I'm talking about have to do with anatomy and the position of our anatomy, meaning the position of our organs. Now, normally in our body, it's called situs solitus, although we don't really use that term in medicine, to be honest with you. We don't say situs solitus. We don't say that. But generally, the heart is aimed towards the left side of the chest. Normally, the gallbladder is on the right side of the belly. The liver is on the right side of the belly. Normally, the spleen is on the left side of the belly, and so on and so forth, okay? Now, when we talk about these conditions, situs inversus totalis, dextrocardia, heterotaxy, we're actually talking about these organs being mixed up, being in different positions. So let's get into it. Starting with situs inversus totalis, that really is an entirely mirror image reversal of all the organs in your chest, the thorax, and the abdomen. So instead of the heart facing the left, it's actually leaning towards the right. Instead of the liver being on the right, it's actually on the left. Instead of the spleen being on the left, it's actually on the right, and so on and so forth. What's interesting is that the relationship between these organs is preserved. It's just that everything is flipped. It's like a mirror image. And interestingly enough, this condition is an anatomic variant that is benign. People often don't even know they have this until they go for testing for some condition or get an EKG or a chest x-ray, and then it's often found incidentally. I've only seen one case of this in my entire, at this point, 17-year career. How common is it? Well, it occurs in about 1 in 8 to 10,000 live births, again, often discovered incidentally. And, people live long, healthy lives in general with situs inversus totalis. In other words, again, the flipping, the mirroring of their organs doesn't really cause any problems. Now let's get into dextrocardia. Dextrocardia specifically refers to the position of the heart and the heart only. So remember when I said that the heart is usually left-leaning? Okay. In dextrocardia means in that person, the heart is leaning and aimed towards the right. Here's an image of a chest x-ray with the heart in the normal position towards the left. Here's an image of a chest x-ray with the heart position on the right. This is dextrocardia. Now, dextrocardia tends to occur in about 0.01% of live births, and there actually can be several contexts in which dextrocardia can exist. So how severe or how serious it is depends on what else may or may not be going on. So if somebody has dextrocardia, their heart going to the right instead of the left, along with situs inversus totalis, that means the other organs are flipped, this is typically benign, okay? So everything is sort of positioned appropriately, it's just reversed, no biggie. Okay. Some people can actually have just isolated dextrocardia, which means it's only the heart that is kind of facing the wrong way. Okay. Instead of left, it's going right, but all the abdominal organs and everything else is normal and in the right place. This condition actually is frequently associated with complex congenital heart defects. So this condition, if somebody just has isolated dextrocardia, generally requires more evaluation, workup, seeing cardiologists, specialists, etc. Then we have dextrocardia with situs ambiguous or heterotaxy. Now this is the most severe, okay? We're going to talk about why, but you should know that this is generally the most severe. The big thing when we talk about dextrocardia is that we're talking about the position of the heart. One thing I forgot to say is that all three of these conditions have genetic causes. People are born with these conditions, okay? So it's not like it's something that happens after you're born. You're born with these conditions, and again, genes are the likely culprit. So now let's get into heterotaxy. This is also called situs ambiguous. This is interesting. This represents an abnormal arrangement of organs that is neither normal, so the organs are not in the right place, but it's not a complete mirror reversal. It's not situs inversus. The organs in heterotaxy are actually all over the place, and it can cause, and often does cause, serious health problems. It's associated with complex congenital heart conditions and heart disease. It's associated with problems with the atrium, the spleen, the liver, gallbladder. I mean, there's a lot of issues here. Again, it is the most severe. It's also associated with primary ciliary dyskinesia in approximately 12% of cases. Heterotaxy is an abnormal random arrangement of organs that falls between normal positioning and complete reversal. And it is the most severe of the three that we're talking about because the consequences honestly can affect so much and so widely. People with heterotaxy literally need to be under the care of multiple specialists. And it's, again, very, very severe and lots of potential clinical implications there. So just to recap, Situs Inversus totalis is a complete mirror image reversal of all the organs. It's benign, not a big deal. Dextrocardia refers to a right-sided heart, which may or may not involve other organs. In terms of how severe it is, it could be not a big deal or it could be a big deal, depending on what else is going on. And then heterotaxy is an abnormal random arrangement of the organs, and that is completely a big deal, has lots of clinical consequences. People need multiple specialists, multiple potential consequences. Let me know if this was helpful. Write in the comments. I'm Dr. Jen Caudle, practicing family physician, on-air health expert, and video creator. Please subscribe to my channel. Follow me on Facebook. I'm on Instagram, TikTok, LinkedIn, WhatsApp, etc. Please subscribe to my free health newsletter at drjencaudle.com.